guests on Keel heard via the Jack Spring Electric Keel Newsmaker hotline. Butch Browning is the state fire marshal. Hey, Mr. Butch, welcome back to Keel.
God bless you.
I apologize in advance.
Yeah, me too.
For Aaron.
Butch, I got a drink 2 weeks ago in a restaurant at 10:30 at night, and now I can't?
Well, good morning. And how do you want to start?
Phase 3 seems like it's stricter than Phase 2.
Let me try this. If Phase 3 is supposed to be better than Phase 2, God have mercy on us if we go to Phase 4. How's that sound?
Yeah. Well, so this is the guidance that came out with Phase 3. So the biggest piece to it was, a lot of these businesses that were at 50% capacity then go to 75% capacity, which includes restaurants, and another big one, of course, was the event centers that were skipped back to 50 people because the numbers had went up. Now can go back to 250 per their capacity rating. As far as the bars and the drinking, the fear from the White House guidance was in bars people congregate, which is why the bars were not recommended in Phase 3. So the fear of some of our restaurants is if they stay open after 10, 11, 12 o'clock, they may turn into what could be a bar situation where people are congregating. So the 10 o'clock last call in a restaurant was in part for that. And keep in mind this is a 28-day period, and hopefully the numbers will get better. But what was added with the bars, which I thought was consistent with a lot of things that were going on across the country, was parishes that have a 5% or less positivity per 1,000 capita in a 2-week period, if they reach that benchmark, then their bars can open under some restrictions of sitting down and that kind of thing. Right now there's about 5 parishes that meet that criteria.
Any in our area?
And well, yeah, looks like the Enfield Parish meets y'all's criteria.
Okay,
Mr. Butch, what about casinos and stopping serving liquor at 10? Do they have to shut it down at 10? Can they start again at 12:01? How exactly is that supposed to work?
No, they stop it at 10, and then it just in the morning. I don't know exactly what the time is in the morning. I'm not a morning drinker. Maybe Aaron is.
Yeah, definitely. 6:01 coffee with Bailey's.
So basically, it's whenever the boats. I'm sorry, no more drinks served or purchased after 10 p.m. But then whatever time the next day, because most of them aren't open all night, then you can kick back into regular hours or whatever, right?
Right. So here's the deal. So on the 16th of this month, LDH will publish that new set of data on the parish positivities. So there are many parishes that are in that 1 week success rate that by the 16th could be eligible. And the other things with the bars reopening is the parish governing authority has to concur with them opening. So just because the state says, hey, you're good to go because of these numbers, it would be up to each individual parish government to affirm that, yes, you can open.
Okay.
But, I think fundamentally, and again, I go back to, nobody likes that some things are closed. Nobody likes that some things you can't do. But fundamentally, we've done a really good job with this personal responsibility, in helping stop the spread of the virus. And so, I think that we're on a good path. There's a lot of fear as far as the Hurricane Laura. Now look at what we're looking at today, with potential Hurricane Sally, the kids going back to school. Now our sporting events are starting to open up too, which I think is good for our communities. So, there's a lot of fears, though, that more of this interaction between people, more congregating of people, may, cause another spike. So that's why it's important people mask up when they're, within someone's, area. They're washing their hands, they're cleaning and sanitizing, and following these basic principles, which in a lot of cases has become second nature. 6 months ago, we never would have even thought of having to do these things.
Mr. Butch, a couple of weeks ago, with the LHSAA and the high school football and stuff like that, originally everything I saw, everything I read, everything I heard was saying that they were thinking, seemed like they were committed to 50% stadium capacities. Now it's 25% of stadium capacities. Can you comment on that? Is there any sort of, can you explain to us how that got cut in half?
Well, I mean, there were a lot of discussions back and forth between the health officials and the education folks. I will tell you, as I understand it, the fear of a 50% versus 25% is, when you go to a football stadium, you all seem to traverse up the same entry and exit ways. Maybe there's one on each end of the bleachers. And typically when people go to a football game, which may last a couple of hours or so, they have to get up at halftime. They may have to go to the restroom. They may have to go to the concession stand. And that maneuverment of people is a lot harder to manage at 50%, trying to maintain social distancing as opposed to 25%. So, we're a restaurant setting where you're at 75% now. People come in individual groups and see they all don't get up and leave at the same time or maneuver at the same time. So I think the health officials' thinking was, at 25% at the point we are now, it's a lot less risk of contact and a better adherence to social distance.
Butch, just us girls talking. Forget about the thousands of people that are listening, okay? This bar thing was really meant for college campuses because A, you got to be seated to get a drink. Am I right about that? And B, you can only serve alcohol between 5 and 10 p.m. College kids typically don't even go out until 10 p.m.
Well, so certainly a lot of the positives were at bars that have a younger crowd or a band with dancing, those things having to stop. But I think the idea of the alcohol being limited to this time will prevent when the bars start opening up again. And look, this gating criteria, as it was explained, where bars can open up with this 5% or less positivity in each by parish is something that's being tried in other states and being recommended, through the CDC. So I think that we eventually get back to there is no last call, early time, or anything like that. But it's just really stopping congregation of people is so important in controlling the spread of this virus.